Hello and welcome to today's webinar, Solving Nurse Burnout. Currently, everybody is automatically muted, but if you have any questions, you can type them into the question box and we'll answer them during the Q&A at the end. My name is Tom DeSantis from LawDo, and one of my jobs is to organize our Thought Leadership webinar series, so I personally want to thank each of you for logging in today. Okay, for our agenda, after the introductions, I'll welcome today's guest, then I'll start by providing some context with a brief review of our research. We'll invite Mimi into the discussion for her perspective of our findings. My colleague Tom Hills will explain how we're solving these challenges, and we'll conclude with your questions. I've planned for about 30 minutes. So before we begin, I wanted to tell you about Laudio. We're a healthcare technology company based in Boston. Supported by research on staff retention and turnover, specifically nurse turnover, we were founded by a group of clinicians, technologists, and analysts to solve the employee burnout issue across healthcare. In this graphic, you can see that physician burnout has been long researched, yet we believe it's the tip of the iceberg. Healthcare staff burnout in general and its dramatic impact on the bottom line is the problem we're solving. I wanted to introduce my colleague Tom Hills, our SVP who works directly with health systems, and he'll introduce the solution at the end. Welcome, Tom.
Hey, thanks. Good afternoon, everyone.
At this time, I want to welcome Mimi Ryan. Mimi's a nurse with 25 years experience, where she has worn several hats, including a nurse manager, a new grad residency program coordinator, and a magnet program director. Welcome, Mimi.
Thank you, guys, and welcome, everybody. I'm excited to be here. I'm sorry I had a little technical difficulty with my computer, so I am on the phone, so hopefully you can hear me okay.
You sound great. Thank you for coming, and tell us a little bit about your background.
Sure. I have had the wonderful experience of working with a nurse manager that really knew what I needed before I did. She would help me with my goals every year and really propelled me into my first leadership position, which was a charge nurse. And before I knew it, I became the interim educator on my unit, which was a progressive care unit, for 18 months. And then I really fell in love with the leadership piece. My first manager job was in a very small clinic with only 6 employees. And then right before my eyes, it grew to 3 clinics very quickly. So I know how it is to go from 0 to 100 miles an hour. After that, I was recruited to another hospital to open their first progressive care unit. And again, the same thing happened. Before I knew it, I had 2 other units. And then I was in that position with those 3 units for about 5 years. And then I was asked to start the graduate nurse residency program at that hospital. And then I started my journey as well as the hospital's magnet journey for the organization.
Excellent. Thanks, Mimi, and thanks for being here. We really appreciate it. And I know you've helped us along the way as we build this product. So we're glad for your input.
It's been a lot of fun. Thanks.
Oh, good. So let's jump right in with the research I was talking about. We've completed 3 studies that I'm going to discuss that help build our technology. And I'm not going to get into a lot of detail. We have done webinars on each of them, and you can access them at no cost on our website, or we could obviously email you the PDFs when we're in touch. The first one was based on a span of control. And just some of the brief highlights from the study that we did. Managers have a responsibility for about 40 to 220 nurses. 85 was the average. And they reported not having a formal manager training once they became a nurse manager. But diving deeper, what we did is we learned that the nurse managers in general are the central to tackling this issue. And Mimi, you've been a manager, you've been a nurse. What are your thoughts on this in terms of the span of control?
So based on my quick ascension into having many employees, I had some priorities, and I felt like even though it was going to take a lot of hours to do this, some things were expected of me and then I expected of myself, which was, of course, rounding on patients and staff daily, which could take up to several hours a day. And I was also thrust into being expected to help with patient care because my critical care unit was very small and didn't have a lot of staff. So I would have to cover the unit when it was short staff. I would help with transporting patients and also doing my manager job of trying to cover the holes for day or night shift. There's a lot of continual tracking of patient experience outcomes. And I really went from being an outpatient manager to an inpatient manager, and I had to learn how to do this tracking and it was continual learning process, learning how to track the quality metrics, what the hospital would need to understand for the whole big picture. And then all of a sudden I was going to many, many meetings every single day.
Yeah,
I'm sorry.
You have to do a lot.
We had to do a lot, yes.
to sum it up.
The one thing was I did have great support of my leadership, and I think that's very essential.
I agree. That's where it starts. I'm gonna jump on our next study. We looked at turnover trends. So we know we cite the NSI study that healthcare staff turnover is around 20%. Nurses in particular around 17% turnover. But we know that's a really large national number, and it varies within organizations and within populations, nurse populations. So what we did is we did a large-scale study. We examined data from 12 health systems, representing about 11,000 nurses, 11,200. Some of what we found supported what we thought anecdotally, like community hospitals had higher turnover compared to academic medical centers, and obviously there's wide variation within the community hospitals. Nurses turn over more frequently in June and December, which seemingly correlates with things like the end of the school year or the end of the calendar year, and people have questioned seasonality in turnover. But I think what surprised a lot of people on the webinar where we presented this data is that the highest turnover is among newly hired nurses in their 40s. So that says a lot about culture, not just about clinical expertise. So we looked at other details like turnover by tenure and even which specialties have the highest turnover. And it's a really great study we did in the white paper that's coming out in about a week. So if you go to our website, you can check that out. But what we did at LawDo is we use this information in our algorithms to build a risk profile for each of our staff members. So at a minimum, when you know these things, this tells us that there are different populations that need differentiated support. So Mimi, you hear about this, and you've been on the floor, you've been a manager, you know that there's different types of populations and people and different types of organizations. What do you think this means? What are the implications for a manager if they were to know this?
So the implication for managers is, I believe I did this, and I believe other people do too, is that we keep things in so many different places. So, there's computer where it files, and then there's paper files, and then there's little sticky notes that we write when we're out on the unit. And to be able to put all that together is difficult, and you can forget things easily that way, and you really don't have a dashboard of really what's going on. If someone quits, how many people quit in a quarter, when do they quit? So it's really great to see your research that you have this ability to put this right in front of you.
No, I agree. So the third study, we actually provided us information. This drives our technology on a daily basis. We looked at benchmarks and a variety of factors that contribute to a nurse leaving an organization. These aren't actually highlights from the study. They're more examples of what are the things we look at. For example, how often does working a night shift factor into dissatisfaction? How much floating can a nurse endure before they decide to leave? Or what is the tipping point for a nurse who gets called in to cover someone else's absence? What this research told us is that there's a good amount of changeable factors that a manager can address, if they had these insights. And Mimi, I know you're going to touch upon this a little bit in the next few slides, but before we go there, I wanted to go back to the big picture. Simply put, the higher the span of control, the higher the turnover. Of course, it makes sense, it's documented, and it's a problem that will probably only continue to grow. The thing is, with technology now, it doesn't seem to have to be this way. In addition to the quantitative data analysis that I just outlined, we have volumes of qualitative data from nurses and nurse managers to better understand the challenges and the way it works today. Tom Hills, you were involved with some of that work. What was the scope of the study?
Yeah, sure, Tom. What we've done is we've been able to interview now some 150 nurse managers and other nurse leaders across hundreds of different institutions across the U.S. To be able to build up not only the quantitative information that you've seen Tom present, but also qualitatively helping us get a better sense of what it's like to be a nurse manager on a day-to-day basis that Mimi is now describing for you. So it's an extensive collection of information. We have 10 nurse managers actually who have been involved with us more frequently on a weekly basis to help us design what you're going to be able to see here in terms of innovation applied to help nurse managers be more effective leaders.
Yeah. All right, Tom, thanks. Awesome. To sum it up before I start advancing the slides, we took all that information, what nurses and nurse managers told us, and we came up with kind of 3 areas or challenges or issues or places of concern that we think we can actually have an impact. The first one, so managers actually don't have easy access to the necessary information that we've been discussing, that Mimi touched upon, that I've touched upon. But we know that nurse managers are extremely resourceful, and they're going to do what they can to get the information. You know, they're using spreadsheets. There's multiple software systems. They have a whole slew of paper files. Mimi, why are managers telling us that this is so difficult to actually know what's going on with the individual nurses on their teams at the individual level?
Sure. So because the managers are multitasking, and that is exactly what it is, meetings and looking at benchmarks, all the things that we talked about, then the multiple places where we put things, I don't know about people on the line, but I have it on the computer and then I have it in my paper file, and that can create a duplication or not having it easily accessible. So it definitely makes it hard for managers to be present and out on the unit. The only way to do that, from my experience, is to work longer, be able to get out there and be visible to the staff, and that is such a challenge with all of the expectations of managers.
Exactly. All right, challenge 2. So no matter what study you read or what report you're looking at, they're going to tell you that communication is key, especially when we're talking about staff engagement. So, how are you communicating, when, how frequently, and actually, are you really, communicating and reaching out at all? Mimi, I think much of what you outlined, is really pertinent to this. How do you get one-on-one? But talk to us about the challenges of simply having that individual, conversation. A lot of what you said, you're in meetings, you're stuck to your computer. There's all of these other demands on you that you actually don't get to build the relationships that are necessary to build engagement.
Correct. And we set that up ourselves because we create this extra layer of leadership, which is our charge nurses and our educators. It was my experience that I used my charge nurses as the first kind of contact. They did annual evals, quarterly evals. They kept track of people's sick calls. And I really needed that because I was so busy doing other things, having 3 completely different units. And so really using them is great, but it also is a pitfall because I had to work harder to figure out what was going on my own units.
Yeah. What's interesting about our call today is normally we talk to nurse executives and we kind of outline what we do. But we're really fortunate, having come from the Magnet Conference, that we've invited a lot of nurses and nurse managers are on the call today. So they're feeling your pain, and they're probably you're validating exactly what they go through. And I know, Tom, when you're with health systems and you're talking about the challenges, you have some insights too.
Yeah, it's been interesting as we've been trying to get into the heart and soul of the workflow for nurse managers. In even just visiting their offices, we could visibly see some of the challenges that we're talking about today. Not only some of the paper-related work processes that are there that have been around for a number of years, but also just some of the things that make it difficult to put your fingertips on data, like using Outlook, for instance, as a filing system, and trying to search and sort and find data always seemed to take too much time. Precious time away from being on the floor to develop these relationships that we're talking about.
Yeah, exactly.
Hey, Tom, can I just add that even when we do use the Outlook, and I'm sure the other managers online agree that when we send it to the staff, they might not even be working that day. And so if they have 3, 4, 5, 6 days off, then they come back and all of that information has dropped to the bottom of their email. So it's really not a good way for us to communicate with our staff at all.
Yeah. Actually, Tom and I were joking with each other on the call before this, is that, we're guilty of using Outlook as our database. When we want to track something, we'll go to our sent file and start pulling. Not the best, and if there's a way to avoid that, something like LawDo, then I'm all for it. All right. Challenge 3. So this is a really big one that we hear in the field because, all of the things we're doing, even if you are doing it, you might not have this tracking, this documenting, and this reporting. So sometimes it feels like you're dealing in a black hole, right? So also, questions you're going to ask: am I doing it equally for each nurse? What I'm doing, is it equitable? Are my efforts actually making a difference? A lot of us talk about, in this type of work, what's the purpose and what's the bigger picture? And a lot of times we get strung along in these corporate initiatives and such, and we want to, what impact is it actually having on my day-to-day and really the satisfaction and health of my nurses? Mimi, how does this tracking challenge? I know you've kind of touched upon it, but how does this help a manager's function? Or can you think of something really specific that's really going to help them out?
What I would like to have had was a dashboard exactly what you guys have. And I haven't been able to get in and play with it, but I have seen it online. And to have things right in front of us, to be able to say, this is how many times nurse so-and-so has called in sick in the past quarter. Is there something wrong? This is how many times, a nurse has not taken a lunch. This is how many times they're taking PTO, and this is what they have left. It's so hard because we're putting so much energy into all these different areas that we don't have one big picture in front of us.
Yeah,
so,
and Tom's going to get into that a little bit in a couple minutes, but in addition to the areas where they need improvement or would need to be addressed, there's things like recognition and celebration, and all of that is in one place. And think about when you're doing your annual evaluations and the burden that is to kind of at the last minute find everything what you need to find to create those reviews. And here it is right here on a profile in every nurse, right? I think there's value in that.
Yes, and instead of I don't know if everybody online feels this, but it's kind of like a last minute kind of thing. So that's why I tried to set up quarterly evaluations. Even with that, you're still racing at the end to get that evaluation done and make sure that person passes, because that reflects on us as a manager. Yeah,
sure. I think we've been talking conceptually a little bit, and we've been talking about the challenges and kind of in a dark place. But I think I want to bring Tom in right now to kind of give us the light at the end of the tunnel. What can we do now? What can we do to save time and increase engagement and make this a better process? So, in a nutshell, Tom, tell us about LawDo.
Sure, Tom. So, as I mentioned previously, LawDo has really been built by nurse managers for nurse managers. What we've identified it as is healthcare's first staff relationship management platform. And what we're doing here is we're really changing the paradigm of staff leadership, especially for large teams. As Mimi has described, today it's largely unstructured and fragmented and manual. And instead, what we've built here is a platform that creates and sustains a structured, repeatable, and trackable leadership best practice. And as a result, you can see some of the results here on the slide. We're reducing burnout, saving managers time, driving best practices, standardizing behavior, which all results in increased engagement and lower burnout and turnover. So there are three main capabilities that make us unique. LawDo first centralizes and systemizes leadership into a one-stop shop management platform. Secondly, we analyze predictive data so managers can act with greatest impact. And third, we standardize a management playbook under one framework. So we'll cover each of these in a little more detail. First, we're giving managers a single platform to more effectively manage and collaborate with their teams, which saves managers time. We combine and streamline workflows by bringing together data from multiple disparate systems like time and attendance, HRIS, and as we said, even paper-based systems like sticky notes and paper files. We then automate work such as attendance and outreach and documentation and make it easier to find somebody on the floor or send them a text or email or make notes to address at a later time. LawDo is also connecting the leadership team and allows the manager to delegate tasks and share conversations and next steps with team leads. Second, on this page, LawDo is giving managers insights by analyzing the data we ingest. So we can suggest actions that LawDo predicts will have the greatest impact on team members at any particular moment in time. So this allows managers to interact with their team in the most timely and effective and efficient manner. And importantly, all activity is tracked. It's measured and updated in real time with views for the team or for each individual as well. So this allows me to see if I'm, as a nurse manager, addressing issues in a fair and a consistent manner, or if I've neglected to recognize certain individuals, say that solid 80% that just come in and do their work every day and leave. who may not be recognized as frequently as they should. And third, we're providing a measurable framework we call CARES to drive consistency, best practice, and benchmarking across the hospital and the health system. This CARES framework, which you can see on the left-hand side, has 5 elements: celebration and recognition, accountability, risk of burnout, employee development, and staff and unit issues. This has been developed from peer-reviewed research and becomes really the manager's playbook, which reduces variability in the practice of managing staff across the health system. So on the next slide, what does this look like in real life? First, nurse managers receive insights generated from the data we ingest. Insights or recommended actions, as you can see here, are prioritized based on how much they predict or are correlated with turnover. So with LawDo as a guide, managers can choose to act with greatest impact on their teams. Whether, in this case, it's Sophie, who's floated a lot last month and deserves recognition for doing so, or Ashley, who has only worked a portion of her required hours during the last schedule block and needs a conversation to understand why, or Robert, who could be at risk of burnout because of all the hours he's been working, or Lenora and Rosalie on the next slide, who are new, and they need my support with 3- and 6-month check-ins to keep them on track. So all of that is done by LawDo advising me how I can have greatest impact with my team. Next, LawDo is freeing my time up to 5 to 10 hours a week for nurse managers by automating existing work such as attendance, outreach, and documentation. So we're combining and streamlining workflows by bringing together data from these disparate systems, as I mentioned earlier, and that then enables us to have greater interaction more frequently, whether it's finding the nurse on the floor or sending a templated text or email that's automatically generated based on context but presented differently every time so it doesn't appear canned, delegating interactions to collaborate with another nurse leader, or making notes to address at a later time. So we can just do all of this with just a click or two without leaving the platform, saving hours of effort each day and week, as I mentioned before. And finally, whether it's an action that's recommended by LawDo or an activity a nurse manager decides to take from their own observations, all activity is tracked and measured and updated in real time. So you can see this includes views for the unit or for the individual as well. And LawDo also provides reporting for leadership so that they can better understand the impact that their managers are making and the balance they're striking when it comes to meaningful interactions and building engagement. So LawDo is proving to make a real difference. Here is past 4-month data from a LawDo beta site at a large tertiary care hospital that's part of a larger academic health system on the East Coast. You can see that LawDo is projected to save nearly 30 nurses a year at this hospital alone. And the hospital is now expanding LawDo based on these results. But importantly, the upside is more than just financial. By increasing the number of timely and meaningful conversations, managers are able to help their teams work to their full potential, which increases, of course, safety, quality, and patient satisfaction. So hopefully this gives you just a taste of what we're doing to help nurse managers be the leaders they always wish for when they were bedside nurses. And you can go to our website or you can contact me directly if you want your team to see a demo of the product. As you can imagine, this is just the tip of the iceberg on what LawDo might be able to do for you. So Tom, I'll hand it back to you.
Yeah, terrific. Thank you. And again, like you just said, this was not really a demo, but if you want to get inside, we're more than happy to do that. We can show you, the multiple points with the CARES framework. So that concludes the formal presentation. We did get three questions that came in, and I'm looking now. I think the first one, Mimi, is going to be for you. What do you think this is probably because of where we just were last week, but how do you think this can help with the magnet application process?
Yes. Increasing the nurse manager's efficiency, and I believe that it would help, this system would help us be proactive and prepared, which would impact our employee engagement. You talked a lot about turnover, and a lot of nurses complain that they don't have nurse manager ability, and so nurse managers can't, so then that would impact burnout, which overall, if we had this great ability to have this on one platform, it would improve all of staff satisfaction instead of the nurse managers. For Magnet specifically, you would have data at the tip of your fingers, and it would help track the nurse outcomes as far as getting certified and their BLS and their ACLS requirements. We keep it in so many places, like I said earlier. It would just be really great, speaking from a Magnet program director position, to not have to take 6 months to pull data from every single area.
Yeah, that sounds like a benefit right there. And we heard that, and Tom, you were there last week in Denver, and we heard that over and over from the people we met at the conference. This question here, fairly specific. We have a recognition tool. Will this integrate?
Yeah, I can go ahead and take that, Tom. And the answer to that question is yes, although we're finding that at our client locations that do have recognition tools, that LawDo is actually becoming their new recognition tool. And also importantly, we're working with organizations like the Daisy Foundation to help promote more recognition of nurses and nurse managers within the platform.
Okay, thanks. The last question was, actually, second to last question, another one came in. This is from Patty. She wants to know what data systems do you import? I'm not sure if you answered that when we got to that section, but
yeah, no, I think we didn't really touch on it directly, but right now everything that you see on the platform is really taken from two different systems that we're integrating with or interfacing with. It's the HRIS system, where we get information on each individual employee, and then importantly the time and attendance systems, which help provide us with the accountability information, the observations in terms of when people are working and when they're not. So what we're doing is really being able to drive great power from just those two systems, although our plan is on our development roadmap to integrate with more systems this next year as we continually get more feedback from our clients in terms of where the platform should move.
All right, terrific. And I think this is a part two. This is from John. He wants to know who imports the data. Is this like the nurse manager? Is this part of their new function, or?
No, that's a great question. And no, so we've designed the platform so that the nurse manager does not have to do any additional data input. What we're doing is we're actually interfacing with the existing hospital's information systems and then bringing that data automatically into the platform.
Thank you. And then this final question before we sign off, can this be used outside of nursing?
Yeah, and that's a really great question as well. You know, when we first started working on this, actually our executive team has deep experience in working with nursing and nursing leadership, and that's what drew us to this problem to begin with. But as we've been deploying Laudio, what we're seeing now is that some 90 to 95% of direct frontline staff are hourly, and this platform does not need to be confined to nursing. And in fact, we're now seeing its application across the entire enterprise.
Hi, this is Mimi. Can I just interject something about that?
Completely.
So as we all know, there are not just nurses on every unit. It takes the whole team of professionals. And Magnet is all about the interprofessional team. And since you are able to integrate this into every team member, this will really, really assist with any organization that's going on the Magnet journey.
Great, thanks, Mimi. Jennifer wants to know, and I should have said this up front and I didn't, can I get the slides to share with my with her leaders? There's actually a recording that I'll make available as well, because as you can see from the slides, there was more talking points than text. So we'll make that available as well as the slides. And again, if you wanted us to reach out and do anything on an individual level for your organization, just Tom's the man for it. So that concludes our discussion today. Mimi, thank you so much for providing your voice and giving us perspective to the work we're doing. We're really glad to have you alongside us. Tom, thank you for joining and showing us a little bit about the platform. And thank you to everybody that actually attended today for your time, because I know you're busy, as we just discussed. So thank you. And if you have any questions, Tom's email's there and his phone number, and we will talk to you soon. Thank you.
Thank you so much.